So carrying on, what is REMS? Well, it's not to be confused with QUS, quantitative ultrasound. It is ultrasound. It is a totally new type of use of ultrasound in bone health and bone assessment, but not QUS, and that is what has been known in the past, and not equivalent to DEXA. But what REMS is equivalent to DEXA, and that's even according to the FDA, which we can see on the right-hand side of the screen here, where the FDA approval for using this BMD ultrasound as an equivalent to DEXA, dual X-ray absorptiometry. So we're completely DEXA equivalent. With that in mind, as I say, we have to look at ways that we can use this technology, and one of the big things at the moment is reviving things like DEXA services or bone density services within hospitals, because that's where they're performed, with the complications that the recent COVID outbreaks and have caused, and non-essential work stopped at hospitals and is being very difficult to reinstate. So one of the main things, or a couple of the main things that makes it difficult to reinstate is because of what DEXA is. I mean, it requires a special isolated room where because it uses ionizing radiation, and it has to be fixed within that room. It cannot be moved out. It is, and so where you have something that is completely portable and transportable, and much easier, being ultrasound, and because of its ultrasound, it is by default much easier to decontaminate than a DEXA table and a DEXA room. So with these configurations that the equipment comes in, you can certainly move the equipment to the patient, whether that be couch side in a physio clinic, whether that's in trauma, whether that's in a hospital bed, whether that's in a care home, or whether that's in the actual patient's home themselves. So completely eliminating the radiation and the portability restrictions that you get with DEXA. Of course, the other thing that we struggle with DEXA is actually using it for monitoring, screening or monitoring. I mean, both of those will actually cause the requirement of multiple scans. Now, DEXA scans aren't repeated more than every 18 months to 2 years. That's reported as it's radiation, so we cannot use it. We cannot use it until we know that we have something to measure with it, and that's all to do with the precision. And so that really, it's the precision of the equipment that is limiting to the number of times it can be used, because radiation cannot be applied without a good chance that you'll get an outcome from that. And when you have the precision figure, when we have a look at the papers that have already been published in peer-reviewed journals, Osteoporosis International with a multi-center study, and Bone with a 5-year fragility fracture follow-up study, we can then now take a look at what the precision is like. And astonishingly, we find that the precision of REMS for both spine and femur are very much better than DEXA. If we look at the bottom line there, the least significant change, it's 5 times better on REMS, which means that when you're only looking for small changes, then you can find that least significant change in a much shorter time. And with the radiation-free aspect of REMS, that allows the scan to be performed again. So monitoring, short-term monitoring is come down from 2 years to 3 months in some cases. The studies also showed, both studies showed, as we see here on the left-hand side of the screen, both studies showed very similar agreement between DEXA and R.E.M.S T-score. And what the follow-up study showed in bone, the fracture follow-up study was that for R.E.M.S, the area under the curve was greater for R.E.M.S than it was for DEXA at a T-score cutoff at -2.5. What that gives us is much better fracture prediction effectiveness using that cutoff, that T-score cutoff. So when you get a -2.5 T-score with R.E.M.S, you're more likely to fracture. So DEXA will be missing some of those at risk at the -2.5 cutoff, and that has been seen in many papers, in many studies in the past. The other things that cause DEXA problems, and it's not about COVID, this is about general problems with DEXA and the shortcomings of DEXA, that it doesn't deal with artifacts and prostheses very well. That is, it's more important in the older generation, and it's the older generation that are usually in the osteoporosis clinics rather than the sports clinics. But as it showed in the video, this technique can in fact avoid the artifacts. And studies or abstracts that have been published at the recent IOF meeting, a virtual congress, actually show that with this technology, the high correlation between, the conclusion here is the high correlation between femoral BMD T-score, sorry, I'll start again. The high correlation between femoral BMD, T-score, femoral neck, and T-score total hip values in the two technologies confirms that R.E.M.S technology is highly reliable examination and fracture risk evaluation. In addition, data obtained on spine lumbar scans show that this technology is able to evaluate BMD more accurately in patients with conditions that can make DEXA exams less reliable. It really means that when you have degenerative change or artifacts in the spine, you cannot rely on a DEXA result from the spine. If your patient has had bilateral hip replacements, then the spine is the only one left. And whereas with DEXA, there is little chance in an older patient that you will get you won't get a false negative because there is of the extra calcification. Another abstract showed case studies showing the same sort of thing, where hip couldn't be measured because of hip replacement. Then we have DEXA of the spine and forearm, where the spine is showing different results to the forearm, but the forearm is very concordant with that of the R.E.M.S results for the spine in one. So the conclusion was the clinical cases show how R.E.M.S technology can be useful in the management of particular patients, assuring accurate evaluation of bone densitometry, the bone density. So that's what it can do. What does R.E.M.S give you? R.E.M.S gives you exactly the same report as you would get from a DEXA. It gives you your image, your diagnosis, WHO diagnosis, T-score, Z-score, BMD value, everything you'd expect from a DEXA BMD report. It also gives you visualization of the B-mode image for the region of interest. So we even have the indication of the regions of interest that have been measured, just as with DEXA. Well, we go on one stage further because the other, in the same measurement and unique to REMS, we have this extra fracture prediction. This is an independent analysis of the same REMS data, but it provides fragility rather than density. And it's known that when you combine fragility, a fragility score with a BMD, you get much far superior fracture risk prediction. So, yeah, bringing back services with REMS would actually increase the capabilities and the availability of DEXA services. So that's really what I wanted to say. So I'm going to now ask Dr. Nick Birch to turn on his webcam, and oh, yes, he is doing that. And I will hand over the control to him, and he will take you through his presentation. Over to you, Nick.